Now the shape and surface topography of the heart. The heart resembles a cone with a basis cordis, position dorsally and the apex directed ventrally, closer to sternum. Okay. In dogs and cats, the heart is tilted at the angle of 15 degree in dogs. The base faces craniodorsally and the apex cardoventrally. And this is a comparative point, guys. Okay. The heart is laterally compressed. Compressed, especially near the apex, adapting to the shape of the thoracic cavity. The base of the heart acts as a hilus where the great veins, inters, and great arteries exist. Two main lateral surfaces of the heart, right side and left side. The right side faces arterioles, left side faces articularis. These surfaces meet at cranial border and caudal border. Cranial border, margo craniolis dexter, right ventricular border, and the caudal border, margo ventricularis sinister, left ventricular border. Auricles. The auricles of the arteria are located mostly on the left, surrounding the aorta, pulmonary trunk. The arteria and large veins are located on the right, grooves or sulci and surface landmarks. Coronary grooves divides arteria from ventricles. It is filled with the fat and coronary blood vessels. Indicates the transition from the thin arterial muscle to the thick ventricular muscles. Right interventricular groove. Located on the right side, it is located on the right side arterial surface and it runs from the coronary groove to the apex. Left interventricular groove. Located on the left side, it runs from the coronary groove to the distal third of the cranial margin. Cardiac skeleton. The cardiac skeleton is a fibrous framework of heart. It is formed by the ring annulus fibrilis that encircles the foreheart orifice, opening of the arterioventricular and semilunar walls. Okay. Composition. It is composed of the dense connective tissue, primarily fibrocartilage, and may contain some. Okay, it is not necessary, but it may contain ossified nodules, called ossa cordis, or we can simply say the bones of the heart. These ossicles occur mostly in cattle. This is a comparative anatomic point. The ossicles occur most commonly in the cattle. It can also be found in other domestic animals, though less frequently. Okay, not necessarily, it is less frequently. Functions: structural support, electrical insulation, and passage for the conduction system. Function: it anchors the heart to the walls and separate the arterial and ventricular muscle layer. Electrical insulation: it prevents direct conduction of the electrical impulses from arteria to ventricular. The electrical impulses generated by the SA and AV nodes. The passage for conduction system. Near the entrance of the coronary sinus, the fibrous skeleton is perforated. This opening allows the passage of the arterioventricular AV bundle. The AV bundle is specialized neuromuscular tissue, essential for the coordinated contractions of the heart chambers.